You are now listening to Sorrel Gore MD.
Sorrel MD. So it turns out that First Lady Melania Trump underwent an embolization procedure yesterday at Walter Reed Medical Center. The White House put out a statement which is accessible online. They state that this morning, First Lady Melania Trump underwent an embolization procedure to treat a benign kidney condition. The procedure was successful and there were no complications. So, two questions. What is this benign kidney condition and what is an embolization? So let's start with embolization. An embolization procedure is a minimally invasive procedure typically performed by interventional radiologists. This is a procedure performed with catheters, which are thin plastic tubes. We thread these through blood vessels, typically advancing them from the groin or wrist. The goal of an embolization procedure is simple: to decrease blood flow to an area of disease. This area of disease can either be a vascularized tumor or it can be what we call an aneurysm. An aneurysm is an abnormal outpouching of the blood vessel that is prone to rupture. The tools that we use inside of blood vessels to decrease blood flow include small embolic particles, rounded metallic coils, or sometimes an intravascular glue that hardens inside and closes off blood flow to small arteries. Oftentimes we use a combination of these devices. So this gets into the second part. What is this benign kidney condition that we're talking about? Well, it's hard to know for certain, but we can speculate that the lesion that Mrs. Trump had is what's called an angiomyolipoma. This is a benign tumor of the kidneys that is known for its characteristic internal fat. In fact, radiologists can usually definitively diagnose this condition non-invasively on CT or MRI imaging. The main problem with angiomyolipomas, or AMLs as they're also known, is that they can bleed. Sometimes the bleeding can be life-threatening. The risk of bleeding is often related to the size of the lesion, and therefore larger AMLs are often referred to interventional radiologists for embolization. It's very likely that Mrs. Trump underwent an embolization under moderate sedation at Walter Reed. IRs probably accessed her right groin and then proceeded to track thin plastic tubes into her renal arteries. From there, they may have used a combination of devices, probably microparticles, coils, and possibly intravascular glue. It's very likely the procedure took anywhere from 1 to 4 hours, and afterwards she was able to recover in a post-procedure care area with only a small nick incision in her groin. My guess is that right now she's recovering on a hospital floor with some attention to her access site in the groin and some monitoring of her hemoglobin values to assess her for possible rebleeding. She may undergo a CT or MRI scan in the near future. I hope you enjoyed learning about angiomyolipomas and embolizations. My name's Sorrel MD. Thank you for watching.